नमस्ते। अब चाहिँ म चाहिँ अर्को टपिकमा जाँदैछु। यो भनेको एभिडेन्स बेस्ड मेडिसिन प्र्याक्टिस रहेको छ। यो चाहिँ अहिलेको जल्दो बल्दो विषय रहेको छ। इज कन्सिडर गोल्ड स्ट्यान्डर्ड फर क्लिनिकल प्र्याक्टिसको लागि चाहिँ एउटा गोल्ड स्ट्यान्डर्ड चाहिँ मानिन्छ। एम टु एप्लाई बेस्ट अभाइलेबल एभिडेन्स gained from scientific method to clinical decision making. Highest importance is given to strongest epidemiological study, most important meta-analysis, systematic review, blinded trial. Least importance भनेको opinion and conventional wisdom of researcher and expert. Statistical parameter used: likelihood ratio, receiver operator characteristic curve. Evidence pyramid in research from top to bottom. Meta-analysis: highest clinical relevance, gold standard. Systematic review, cohort study, case control study, case series, case report. Ideas, editorial opinion. Animal research, in vitro test tube research. Lowest clinical relevance रहेको छ। Measurement in epidemiology. Tools of measurement in epidemiology. Rate. Numerator is a part of denominator and multiplier is 1000 or 10,000, 1 lakh and so on. Ratio. Numerator is not a part of denominator and both numerator and denominator are unrelated. Proportion. Numerator is part of denominator and multiplier is 100. Proportion is always expressed in percentage. Example of tools of measurement in epidemiology. Parameter, formula, numerator and denominator. Conclusion. Infant mortality rate. Number of infant death divided by number of life birth per thousand. N is a part of the multiplier, not 100 rate. Maternal mortality ratio. Number of maternal death divided by number of live birth per lakh. N is not a part of the both unrelated ratio. Sex ratio. Number of female divided by number of male. N is not part of the both unrelated ratio. Incidence. Number of new cases divided by total population rate risk 1000. N is a part of the multiplier, not 100 rate. Prevalence. Number of new plus old cases total population per 1000 and is a part of the multiplier 100. Proportion. Case fatality rate. Number of death, number of cases 100 and is a part of the multiplier 100. Proportion. Relative risk. Incidence among exposed by incidence among non-exposed and is not part of the both unrelated ratio. Indicators of health. Mortality indicator, crude death rate, life expectancy, infant mortality rate, child mortality rate, under 5 proportional mortality rate, maternal mortality rate, disease specific mortality rate, and proportion mortality rate. Morbidity indicator, incidence and prevalence, notification rate, attendance rate at OPD, health center, admission rate, admission and discharge rate, duration of stay in hospital, spell of sickness or absence from work, school. Disability rate, event type indicator, number of days of restricted activity, bed disability days or class days. Person type indicator, limitation of mobility, confined to bed house, special aid in getting around, limitation of activity, limitation to perform ADL, limitation in major activities. Nutritional status indicator, anthropometric measurement of preschool children, height of children at school entry, prevalence of low birth weight. Healthcare delivery indicator, doctor population ratio, doctor nurse ratio, population bed ratio, population per health center, population per traditional birth attendant, utilization rate. Proportion of infant fully immunized against 6 EPI diseases, proportion of pregnant women who receive antenatal care, percentage of population using various methods of family planning, bed occupancy rate. Average length of stay in a hospital, bed turnover ratio. Indicator of social and mental health, suicide, homicide, act of violence, road traffic accident, alcohol or tobacco use rates. Environmental indicator, air or water pollution indicator, proportion of population having access to safe water supply and sanitation. Socioeconomic indicator, per capita GNP, level of unemployment, dependency ratio, literacy rate, health policy indicator, proportion of GNP spent on health service, proportion of GNP spent on health related activity, health policy indicator, Indicator for quality of life, physical quality life index PQLI. Other indicators, social indicator, health for all indicator, STG indicator. New WHO recommended death certificate for international use. International death certificate consists of 5 line. Line IA, disease or condition directly leading to death. Line IB, antecedent or underlying causes. IC, main underlying causes. If line ID could be filled up, it become the main antecedent underlying causes. Line second, in other significant condition contributing to death but not related to disease condition causing it. Example of the death certificate. Example 1, line IA, renal failure. Line IB, diabetic nephropathy. Line IC, diabetic mellitus. Line IT, line second, hypertension, maybe hypertension हुन सक्छ. Example 2, line IA, intraperitoneal hemorrhage. Line IB, rupture metastatic deposit in liver. Line IC, metastatic deposit in liver. Line IT, primary adenocarcinoma of ascending colon. Line second भनेको hypertension. The concept of underlying causes, line IC or if line IT could be filled up is the most important line in death certificate, thus also known as the essence of death certificate. Mortality measurement, crude death rate and crude birth rate. Crude birth rate, annual number of live birth per 1,000 meter population. Crude birth rate, number of birth in an area in a year, total meter population per 1,000. Crude death rate, number of death in an area in a year, total meter population per 1,000. Specific death rate may be caused disease specific or group specific, age specific, sex specific, age specific. Help identify particular at-risk group for preventive action. Permit comparison between different causes within same population. STR, number of death from a specific cause in a year divided by meter population per 1,000. Standard death rate. Proportional mortality rate. Proportional mortality rate is number of death due to particular cause or in a specific age group per 100 or 1,000 total death. Advantage of proportional mortality rate, simplest measure of estimating the burden of a disease in a community. Disadvantage of proportional mortality rate, does not indicate the risk of member of population contacting or dying from the disease. Case fatality rate. Case fatality rate representing killing power of disease. It is closely related to virulence of organism. Case fatality rate is a proportion always expressed in a percentage. Case fatality rate is equal to 1 minus survival rate. Limitation of case fatality rate, time interval is not specified. Usefulness of case fatality rate is limited for chronic diseases. Case fatality rate is equal to total number of deaths due to disease divided by total number of causes due to disease per 100. Survival rate. Survival rate is the proportion of survivor in a group. Example, a patient studied and followed over a period of time. Example, over a period of 5 years, is used to describe prognosis in certain disease condition. Quite useful in cancer study, can be used as a yardstick for the assessment of standard of therapy. Survival period is usually not from date of diagnosis or start of treatment. Survival rate, total number of patients alive after 5 years divided by total number of patients diagnosed, treated per 100. Standardization of death rate, adjusted or standardized rate. While comparing of death rate of two population, crude death rate is not the right yardstick. Age comparison are different. Age adjustment or age standardization remove confounding effect of different age structure. Standardization may be direct or indirect. Standardization is carried out beginning by using a standard population. Standard population is a population whose number in age and sex group are known. To frequently use standard population are secure population and European standard population. Choice of standard population is arbitrary random. Available standard population may be used. Standard population may also be created using two population. National population need not always be taken as a standard population. Is commonly used in occupational study. Comparison of mortality in an industry and general population can be used for occurrence of disease rather than death. Okay. Type of standardized death rate. Direct standardization method is a specific rate of the population whose crude death rate is to be standardized, is applied on a standard population. Total expected death calculated. Total expected death divided by total standard population to yield standardized death rate. Indirect standardization. Standardized mortality ratio is the simplest and most useful form method. Calculate expected death, assuming that study group experience the death rate of standard population. Feasibility permit adjustment where a specific rate are not available or are unstable because of a small number. Example of indirect standardization. Standardization mortality ratio, observed death divided by expected death into 100. Life table analysis, survival analysis, regression analysis, multivariate analysis. Direct standardization and indirect standardization method use actual age standardization death rate on the standard age structure. Use standard age specific death rate on the actual age structure. Number of death in each age group, population in age group, both are available, both are unavailable. Morbidity measurement को कुराहरु आयो. Incidence